Hello everybody, welcome to my channel. This channel is called The Nursing That Makes Sense. It's a channel for a nursing student who want to learn anything about pharmacology, about physiology, pathophysiology, and any diagnostics that we encounter not only in the classroom but also in the hospital or clinical settings. This channel is also for nurses who've been out of the nursing school and who are currently working. It doesn't matter what particular settings you are, this is like a refresher course for what we have learned in the past in nursing school. However, the channel is really primarily for nursing students. The other feature of the channel is I'm gonna be making video that's going to be only 10 minutes long. Anything more than that, I will cut it and then put it in another video. If you're like me, anything more than 10 minutes, my attention span is too short nowadays, so I may not be able to understand or recall anything after the 10th minute. So I will cut it short. If there is a need to extend another video, then I'll do that for everybody. For this topic, for this video that I'm creating right now, we'll be talking about a basic metabolic panel. Every now and then you hear the word B meta, every now and then you hear the word chemistry 7. So B meta is one of the most common laboratory diagnostics that we always send to the laboratory to determine the electrolytes imbalance or balance of our patients. So a couple of electrolytes that are recorded or reported in the chemistry 7 or B meta, these are the following: the glucose level. You're going to see calcium, you're going to see sodium, you're going to see potassium, you're going to see bicarbonate, you're going to see chloride, blood urea nitrogen or BUN, and then you're going to see creatinine level. So what I'm going to do in this video, I'm going to first talk about glucose level, and then I'm going to go to calcium, sodium, potassium. As you can see, I'm going so on until we finish the electrolytes that are reported in B meta. So the first thing is glucose. Now, as you could see, I used a particular range, 70 to 100, for the purpose of this kind of presentation. Now, I want to caution everybody, please review the hospital policy or the settings policy. Whatever the normal range of the glucose level that are reported in the laboratory, that's the normal range you're going to use as a reference, not the one I'm presenting to you guys. I'm using this because this is the common number that I often see when I see chemistry 7 or a B meta reported. So before I go into details on the hyper and hypoglycemia, I want to talk about how glucose is produced. So let's begin. So well, before we begin, by the way, if you are into this kind of topics, if you're interested, please subscribe to my channel, because every day I'll be producing new contents for everyone. Like I said, primarily for nursing students, for also nurses who are already practicing nurses in the clinical setting. So let's start, right? So where is glucose produced? Well, primarily it's in the liver. And there are two processes in which glucose are produced. The first one is what we call glycogenolysis. Now, the word lysis will give you an idea that it's a breakdown. That word alone, lysis, is a breakdown of something. In this situation, it's a breakdown of glycogen in order for it to be produced as glucose. So that's one mechanism in which glucose is produced. The second mechanism in which glucose is produced is due to gluconeogenesis. Now, the word genesis is going to give you an idea that it's a production of something. Now, in the situation of glucose production, this is the production of glucose using non-carbohydrate substrates. So what do I mean by that? They're not carbohydrate based. They are either protein or fats. Now, in terms of protein, the smallest particle, I'm just going to use that. The basic particles of protein is amino acids. And then for fats, the basic particles for that would be lipids. So the production of glucose using a non-carbohydrate substrate. So they are lipids and amino acids. So normally, right, when we start eating, the thing that happens is the blood glucose goes up, and then the body starts producing this insulin so that the body can start utilizing the glucose that was produced. Now, when I say something about nursing that makes sense, the next slide that I'm going to show you are two things that will make sense when it comes to glucose physiology. So these are the two things that when I was in nursing school, and I'm already a nurse right now, I always think of this and kind of remember this, not only memorize this, but actually remember it and understand it, because these two concepts actually make sense when it comes to glucose physiology, on how glucose is produced, right? So the first thing, the first bullet point, as you can see in the screen, it says increased glucose eventually stimulates the production of insulin. So when the insulin is produced, guess what happens to the glucose level? Instead of continuously going up, it's going to destabilize and it starts to go down. So there is that balance situation when there is increased glucose production. Exactly the opposite when there is a small amount of glucose in your blood or in your system. What happens is the body starts inhibiting the release of insulin. So when it starts inhibiting or antagonizing, those are the terms that you're going to hear, or preventing the release of insulin. So guess what happened? If there's not insulin, a hormone that actually mitigates glucose, then therefore what happens to the glucose level? It's gonna go up. So these two bullet points are the things that make sense when you really think about glucose physiology. So now let's go to the conditions, either high or low, right? Okay, so the terminology that we often use for anything that's higher than the normal range, which is the highest point of the normal range, we always say the word hyper, right? We start with that word and then we add something. So in this situation, anything greater than 100, we're going to consider hyperglycemia. So what are the predisposing factors, or what are the determinants of hyperglycemia? There are a couple of things, but for me that really makes sense. It boils down to two things. It's sympathetic stimulation. So what are they? Stress causes hyperglycemia, right? Sympathetic stimulation, elevated blood pressure, anything like that. Any stimulation to the cardiovascular system can actually increase glucose level. The second thing that you always need to think about is the idea of the pharmacology that we give all the time. For example, of drugs that would increase blood glucose level are beta agonists. What are they? Albuterol is an example of a beta agonist that would increase the blood sugar. Now, what are the possible complications associated with hyperglycemia? Diabetic ketoacidosis and hyperosmolar hyperglycemia non-ketotic syndrome. This is if you have type 1 diabetes for DKA and type 2 diabetes for non-ketotic syndrome. What do we do? Insulin, right? That's the best drug for any hyperglycemia. Now, the next situation is exactly the opposite, which is hypoglycemia. What are the possible causes for that? Hold and behold, too much insulin, right? And guess what? Drugs. Drugs can cause hypoglycemia. A perfect example would be beta blockers, are going to be perfect example for that. Now, what are the complications for hypoglycemia? Worst case scenario, you guys, there are cardiovascular complications, and they can be as worse as ventricular tachycardia or VFib. In terms of CNS or cerebral nervous system, central nervous system, unconsciousness. So what is the treatment for hypoglycemia? Bingo. Boom shakalaka. You got that right. It's D50. Okay, so this is the first portion of the chemistry 7 when it comes to the electrolytes. So in the next video, I'm going to start talking about the calcium and what happens with hypocalcemia and hypercalcemia. So again, if you're interested with this kind of content, please subscribe to my channel so that you get notifications that I have new videos that I uploaded in my channel. Thank you very much.